Okay, I'm going to just touch on this part really quickly. As I mentioned earlier, we do provide some services to younger adults. About 7 years ago, the state became part of a national initiative to establish aging and disability resource centers in every jurisdiction in Maryland. A byproduct of that was that there were some additional funding options under Medicaid Expansion that we became eligible for by establishing Aging and Disability Resource Centers, or ADRCs, in every jurisdiction in Maryland. And those are, for the most part, all in offices on aging across the state, although I think there's one or two that are in a health department. I'm not going to read through the whole slide because I basically just described to you kind of what it says, but the struggle that we had when this new program came our way is that, first of all, it was one of those wonderful projects where there's funding for a few years and then it goes away and sustainability magically happens. Has anybody found the sustainability fairy or the magic wand that makes that happen? Because we're still looking. So that was concerning for us, especially because people who are familiar with our office know that there's a depth and breadth of services we bring for seniors that we could no way, no how bring to the younger adult population with disabilities, because we don't have the resources for that. And just because we got this new title didn't mean that there was a whole new breadth of services and resources out there for this population. So that was a little frustrating for us, and because I have a phenomenal team of people I work with at the office who always want to do more than we really can. So we had to work real hard on knowing what our boundaries were with this population. But I do think we do, and we've learned an awful lot about resources for the disabled community. And so that's kind of what made us an ADRC. And this basically tells you we serve our population we've always served as the Office on Aging, older adults, persons 18 and older who have a disability or a chronic condition. A lot of the calls that we get from disabled younger adults are people who have become recently disabled. They've had an injury, a fall, a stroke, something like that. Because for the most part, people that have a lifelong disability are already connected into services. It tends to be people who are transitioning through some crisis in their life and needing some disability supports. We also provide supports to caregivers, and then, like I said, we kind of play that traffic cop, connecting people to information and resources and community supports, which, of course, there are never enough of. So I'm going to hand it over to Lisa now, who's going to touch on another aspect of Medicaid expansion, which has to do with the level 1 screening and how that works and how you could refer people for that program.
Good afternoon. So, as Karen stated, the level 1 screen came as a byproduct of the Medicaid expansion. So, what the level 1 screen does is it triages clients for specific Medicaid programs like Community Options Waiver or Community First Choice or CPAS, Community Personal Assistance. Also, just for some of those who've been around a while, it used to be called MAPC. It's now CPAS. So anyway, those are the sorts of things that we do when we conduct a level 1 assessment. We ask these specific questions, and we can do it over the phone or in person. We can do it with the client or with their caregiver. So who should be referred for a level 1? Those who have indicated a need for long-term supports, regardless of their payer, who's paying. That question comes up later, so it's a very important thing that we recognize that all should be able to have the level 1 assessment if necessary. Those that they indicate the need for assistance with their ADLs, that's really critical. Those that request it or have multiple or complex needs. Those who wish to be on the waiver registry, and we all know the waiver registry is a very long one. It's currently at 7 years. However, they are doing what we call waves, where they're going out and they're seeing, has the needs changed? And I would encourage you, if you've made a referral for a level 1, within 6 months, after 6 months, if there has been a significant change, please redo it, because I believe that people need to have the most we need to have the most updated information that we can. The LTSS system is the system that is used for the level 1 screening, and it goes every day with MMIS, and it's a very quick system, and it can help perhaps to locate services for individuals. So who should not have a level 1? Those who are in a nursing home or a nursing facility. Those who are currently under the waiver should not be referred for a level 1. Those who don't need long-term supports. And if you ever get those individuals who currently have waiver services, just refer them back to their supports planner. It's really not an appropriate time for them to have another level 1. So how do you do that? The level 1 is a complete little intake form. It's in your packet. It's just a one-sheeter. Just gives me a quick, brief, information that I can use. When I call these folks, a lot of time I'm calling them cold. And they've been told, don't give out your social security number over the phone. And here I am asking them, could you tell me what your social security number is? They don't like it. So if you could, please, when you make the referral to me, please already have their social security number and their Medicare number, which can be different. So you can fax it to me at, I didn't put my fax number down, but you can either fax it to me or you can email it to me directly. Either one, and we'll take care of it. Level 1s we tried to do in 2 to 3 days after we receive them. So, unless I can't get a hold of folks, and then I'll let you know. Is there any questions? Okay.
I realized we spent so much time making sure our slides were right that we didn't put our fax number on anything, I don't think. But it is on the highlight sheet that should be in your packet. It's a double-sided blue and green sheet that has our fax number on the bottom of it, and it's also in the Caregivers Toolkit that I want to call your attention to that we provided to everybody. I'll just do a brief commercial for this before Patty comes and talks about, I know everybody's so excited to hear about the Medicaid waiver. It's not really complex at all. We'll just breeze right through it. But the toolkit is a document we have. It's available online. We also have gobs and gobs of copies at our office. So you are welcome, your organization, your agency, wherever you may work, to stop by and pick up a bunch of these and keep them so that when you get someone that you're working with and they need to know about resources, and this is a resource guide not just for older adults, it also has a section on younger disabled individuals who are living with a disability so that they have some information as well. And so it's a free resource, and we encourage you to please let us know if you'd like copies. We have a lot of them. We're happy to share. The one thing I wanted to mention about the waiver registry, as Patty comes up to talk, is that there was a big push, and it's a continued push, to do a mail out from the Centers for Medicare and Medicaid Services to the community. They got letters. They're doing that to purge the list. It's really important if you're working with someone who ever put their name on the registry and they get mail that they respond, because that's how they're keeping that person on the registry. And if they do those mailings and contact them and they don't respond, they will be taken off that registry list. And it is such a long wait. We would hate to see that happen to somebody who really does need the services. So it's really important if you're working with somebody, just because they were on the registry doesn't mean they stay on there infinitely. It's good to do that update of the level 1, like Lisa said, but it's also really important to make sure they're responding to their mail, opening their mail. So Patty's going to talk about waiver services.
Good afternoon, everybody. Good afternoon, people in Harford, Grace. So, the waiver services. I'm going to do my best to try to explain this. I have had the pleasure of working at the Office on Aging 9 years now, and seeing community services for seniors from the very beginning, like what services are available. The waiver I have always referred to as the golden ticket. Those of you who have folks that have finally made it to the waiver services, it really is, as compared to our other programs in the community, the waiver program is really a great program for our seniors and for our younger disabled folks. So what is the waiver program? So the waiver, it used to be referred to as waiver for older adults. There was also the younger adult waiver or the living at home waiver. So a few years ago, they merged, and now everything is considered Medicaid home and community-based option waiver. So as you can see, there are two different criteria that must be met in order to be a waiver participant. We're looking at financial eligibility, which is actually, it's saying here 300%. It's actually is $2,207 is the income requirement for the waiver program. Up here. And then, of course, there's the medical criteria. So those two things have to come together to be able to be eligible for the waiver program. There are two ways to get to the waiver program. You can either, as Lisa was saying and Karen was saying, be on the waiver registry. So you've called in, you've done your level 1 screen, you've got all your information in the tracking system, and that's how they've scored where you are as according to need. So those are folks that might be sitting in the community still waiting for assistance in the home. Because when you're put on that waiver registry, they're not doing that initial or that medical assessment where they're saying, okay, these are the exact services that you need. They're getting a baseline where they're doing the level 1 screen. So when you've got people on this waiver registry, they're folks in the community that we know are going to be needing services, it just hasn't been determined exactly what they need. The other folks that are eligible for services are the ones that are already in nursing homes. So they meet a nursing facility level of care. And that's big because we have a lot of folks that may need help that senior care might be appropriate for. But you've got to meet that nursing facility level of care in order to get the waiver. It's for folks that are 18 or older. And the big caveat is they have to be willing to accept services in the community. So if you've got someone who meets nursing facility level care, someone who's already in a nursing home that wants to come out to the community, that's what they're choosing. They're choosing to get nursing facility level care in the community. It's got to be carefully planned. It's not, you're not going to have a nurse 24/7. It's realistic, and it's a lot of times folks want to have services in the community because it's a home setting. They don't want to be in a nursing facility because they may consider it a little more cold. So that's when we're going out and talking to the folks in the nursing home. That's what we're looking at is what is their choice. It's a lot of these programs are about what the person's choice is. So when we've got this person that we determine if they're eligible, the financial part gets sent downtown to the state, and that's the eligibility determination division. So all that gets handled by the state. They're the ones that make that determination. And again, it all has to kind of come together in perfect timing. For the folks that are in the community that are wanting to get on this registry, the best way is to call the numbers that are listed. We realize sometimes calling down to the state is not always easy. So if you're kind of getting, bumps in the road along the line, please let one of us know and we'll make sure we get it to the right person. But that is the best way. The state wants us to do it that way so we can track the numbers of folks that are trying to access services. Let's see. So what is the waiver? What does the Community Options Waiver cover? And this is a list, I'm not going to read it, but basically the difference with the medical assistance waiver is you can get these types of services in the community, but you can also get assistance with paying for assisted living. So a lot of folks that you may come in contact with, the doctor might be recommending they need assisted living care. That's great, but paying for assisted living is the hard part. So with the waiver, that's the beauty of it. So you've got someone who needs 24-hour care, they can go to an assisted living, have that 24-hour support, have someone monitoring them, but it's not a nursing facility. So it's kind of the in-between. It really is a nice solution for folks. So this, when we come across people that might not have supported home, assisted living is, of course, we're hoping that we can get them to that route, but paying for it, that's what the waiver can do. It can help pay for that. And these other services that you see here are for folks that maybe are not in an assisted living. So for example, we have a waiver client. She is living with her son and daughter-in-law. She does have these things. She has access to personal care. If they're in an assisted living, they're already getting that, so that wouldn't be additional on top of the assisted living, if that makes sense. I see a couple faces. Does anyone have any questions about that? About the difference between the waiver, in the community, living in a home, or living in an assisted living? Okay. When you do have someone that already has the waiver services, they've been assigned a support planner. The Office on Aging, we have some of those folks, but we are not the support planner for all of them. So if, whoever may have access to LTSS might be able to say, okay, look, this person is, they've got a support planner that's with the coordinating center. Right now, I believe we have, 4 support planning agencies. So Office on Aging is one, the coordinating center, Beatrice Loving Heart, and Mars. So we may be one of those. And if you're not sure how to get to that person, that support planner, we might be able to help you say, hey, this is the person to call. But really, you want to start with that agency. Support planner is basically the gatekeeper to services. I think that's about it.
Yep.
Any questions? I rambled pretty quick.
Harford Memorial, any questions? Okay. Just to reiterate again, because is there a question in the back? Yes, Jan.
Just a clarification so that everybody understands, because I know you said this, but it may not have been clear, is that when you get somebody on that waiver registry, they're not getting on a waiting list to start the services. They are getting on a waiting list to apply for the program.
Right. So the question was, or the comment was that the difference between the registry, so getting on that level 1, getting that your name on the registry, that's that level 1, that's that intro into the system. So your name is getting put on a list. It does not mean that you're the next one up in line. Basically, right, they're ranked according to need. So someone who needs assistance, might have a higher need, is going to get listed a little bit higher on that waiting list. Just to go back, I do better with giving personal examples. When I first started working in outreach, I screened a couple of folks and I helped them put their name on the waiver registry, the waiting list. Just recently, they're getting letters saying you are being invited to apply for the medical assistance waiver. So it's still another step beyond that. So that calling in is great, but they've got to be invited to the waiver program. So these folks, it's been a good 8 years since I put their name on the list, and they're just now coming up for services. So when I call it the golden ticket, I actually, my colleague referred to it as pie in the sky. It really did happen. It really came through, and these folks are thrilled because now they can stay in the assisted living that they've been struggling to pay to get, to stay there. So it really is a good program. Hey, Joe.
I just wanted to add that if the client is in the nursing home and they're interested in coming out of the nursing home onto this waiver, and they call that number, they do get assigned an options counselor, which is very, very helpful in them making that decision and transferring from the nursing home into the community. Before they ever get the support planner, they have an options counselor.
Right, thanks. So the comment was, basically, if someone is already in a nursing home, they can be referred for options counseling. And that's that number. So if you've got, a family member who's in a nursing home and, is interested in coming out, they can call and get their name on that list, and they will be referred for options counseling. And options counseling, that's a quicker route to get out into an assisted living. So the folks in the community are waiting, a lot longer, but if they're already in a nursing facility and they've met that nursing facility level of care, they can come out with the options counseling and they can then apply. So it's still a process. It doesn't happen right away. They've got to be eligible for long-term care medical assistance. So there's quite a bit that needs to happen, but that is that's the shorter route to get to the waiver than to wait in the community. So, all right, thank you.